It is already time to start, colleagues. Today we talk about prophylaxis in pediatrics. You know, this is a preventive measure. The word comes from Greek, as many other terms in medicine, and means an advance guard. This is a measure taken to fend off a disease or another unwanted consequence. Prophylaxis is primary when we prevent infection before the first occurrence. Secondary prophylaxis means to prevent recurrence after a first episode. Prophylaxis may include antibiotics, the use of antibiotics, immunoglobulins, or monoclonal antibodies, vaccines, alone, each of them, or in any combination. Immunization is one of the most beneficial disease prevention measures available. As a result of effective and safe vaccines, smallpox has been eradicated, polio is close to worldwide eradication. Immunization is the process of inducing immunity against a specific disease. Immunity can be induced either passively through administration of antibody-containing preparations or actively by administering a vaccine or toxoid to stimulate the immune system to produce a prolonged humoral and cellular or only cellular immune response. Active immunity is the resistance developed in response to stimulus by an antigen. It may be infecting agent or vaccine and is characterized by the production of antibodies by the host. Passive immunity is the protection against disease through antibodies produced by another human being or animal. Examples for these are the maternal antibodies who pass transplacenta, colostrum, the first milk after the birth of babies. Passive immunity does not last as long as active immunity, only several weeks or several months, and no lymphocytes are stimulated to clone themselves to differentiate the B cells. We talk next time about immunity. B cells to turn into plasmocytes and produce immunoglobulin antibodies. No memory cells have been made. It is effective immunity, but temporary, and it can only last as long as the antibodies last in the blood. Active immunization induces immunity through the administration of a vaccine or toxoid. That means inactivated toxin. The toxoid is inactivated toxin. Passive immunization includes transplacental transfer of maternal antibodies and the administration of antibody either as immunoglobulin or as monoclonal antibody.
Professor,
Yeah,
sorry for interrupting, but I think we have a problem with the slides. We don't see the changing of the slides.
uh, what can we do? You don't. You asked which slide?
Quit from the full screen. Now yes, we are on the 9.
So I must not do it whole screen. No.
Yes, just don't do it whole screen. Just
Okay, okay. And which slide did you saw last?
now we are on the first one. Go
Yes, and I have reached already the
9.
this one.
Okay, just change it from there. Okay,
Okay.
thank you.
So immunizing agents are vaccines, immunoglobulins, and anti-sera. Immunoglobulins, we will talk about them in details next time. There are five major classes, IgM, IgA, IgG, IgE, IgD, and two types of immunoglobulin preparations are available for passive immunization: normal human immunoglobulin and specific or hyperimmune human immunoglobulin. Antisera or antitoxins are materials prepared in non-human sources, usually that are animals such as horses. So here you have a list of immunoglobulin and antiserum. Human normal immunoglobulin for hepatitis A, for measles, rabies, tetanus, mumps. Specific immunoglobulins for hepatitis B, varicella, diphtheria, and non-human immunoglobulins or antisera for diphtheria, tetanus, gas gangrene, botulism, and rabies. The method of giving antigen to stimulate the immune response through active immunization is called vaccination. A vaccine is an immune biological substance designed to produce a specific protection against a given disease. Vaccine is antigenic but not pathogenic. Some historical facts. There are evidence that Chinese employed smallpox inoculation or variolation as early as 1000 before Christ. It was practiced later in Africa, 1706, and Turkey as well, and then it spread to Europe and the Americas. The first doctor who successfully used cowpox material to create immunity to smallpox is the famous Edward Jenner. You see, this was uh, in fact, three centuries ago. This practice was widespread, and the method later underwent medical technological changes and eventually resulted in the eradication of smallpox. Then Louis Pasteur, the famous microbiologist, in 1885 invented rabies vaccine. He created the first laboratory vaccine at the at the end of 19th century for chicken cholera. Here you have the list of vaccine preventable disease. There are quite many. And the herd immunity plus aggressive immunization has made most of these diseases rare. So the current residents and medical students haven't seen these diseases, cannot see them. Vaccines. The vaccines use a variety of different substances, starting from dead microorganisms to genetically engineered antigens to defend the body against potentially harmful microorganisms. According to this, a vaccine may contain live attenuated or killed microorganism or parts or products from these microorganisms, but all of them capable of stimulating a specific immune response. So the types of vaccines are live vaccines, attenuated live, inactivated killed vaccines, toxoids, polysaccharide and polypeptide, that means cellular fraction vaccines, and surface antigen. These are the recombinant vaccines. Live vaccines are made from live infectious agents without any amendment, but the only live vaccine is variola smallpox vaccine, which is made of live vaccinia cowpox virus, not the variola virus, which is not pathogenic but antigenic and gives cross immunity for variola. However, this is a vaccine existing only in laboratories. It is used no more. The live attenuated avirulent cold vaccines are vaccines where virulent pathogenic organisms are treated to become attenuated and avirulent, but they remain antigenic. They have lost their capacity to induce full-blown disease, but retain their immunogenicity. The live attenuated vaccines should not be administered to persons with suppressed immune response due to some neoplasma like leukemia and lymphoma, the other malignancies, people who receive corticosteroids and antimetabolic agents, who are under radiation, or pregnant women. Most live attenuated vaccines are administered in one or two dose schedules And the purpose of repeat doses, such as a second dose, or for instance of the MMR vaccine, is to induce an initial immune response in people who fail to respond to the first dose, or in some cases, if there is a big uh, interval between the vaccines, they need booster dose. Influenza vaccines are recommended to be administered yearly to provide protection against changes in circulated influenza uh, strains. Each year they are different. The inactivated or killed vaccines contain produced during infection rather than act upon the organism itself. In general, toxoids are highly efficacious and safe immunizing agents. Polysaccharide and polypeptide or cellular fraction vaccines are prepared from extracted cellular fractions. For instance, meningococcal vaccine is prepared from the polysaccharide antigen of the cell wall, the pneumococcal vaccine from the polysaccharide contained in the capsule of the organism, and their efficacy and safety appear to be high. The surface antigen or recombinant vaccines, we have here the example of um, hepatitis B vaccine. It is prepared by cloning the HBs antigen gen in yeast cells where it is expressed along with together with DNA. The hemoglobin the hepatitis B antigen produced is used for the vaccine preparations, their efficacy, their safety. Here you have again the list of different kinds of toxins against different disease, but we will talk in details for all of them that are used in children. The routes of administration. Usually, or most of the vaccines are done by deep subcutaneous or intramuscular routes. Oral route for polio vaccine, but now it is not a single one. It is uh, produced together with 5 or 6 vaccines, so we don't use no more oral polio, either oral BCG vaccine, but in some countries they are still produced. The route of Bacille calmette-guerin, the BCG vaccine, is intradermal. Intradermal, you will have some details about this. Scarification is done for smallpox vaccine, but no more. It is eradicated. And intranasal route, still there are some leaf attenuated influenza vaccines who may be done by intranasal route. The maintained immunity, the periods of maintained immunity due to vaccine is important. Some of them they have several months, quite a short period, like cholera vaccine. For 2 years is the typhoid vaccine. 3 to 5 years for diphtheria, polio, tetanus vaccine. So we have to repeat it in children. 5 or more years is the BCG vaccine. The longest is 10 years is the yellow fever vaccine. Solid immunity there is after measles, mumps, and rubella vaccines. To maintain the immunity level after it declines in some time, we do the booster vaccination, and this is the diphtheria, tetanus vaccine, and MMR, as I mentioned already. The levels of effectiveness is different as well. Absolutely protective, 100% is yellow fever vaccine. Almost absolutely protective are measles, mumps, rubella vaccines, diphtheria, tetanus, toxoid. Highly protective, up to 95%, polio, BCG, hepatitis B, pertussis, and moderately protective are the typhoid vaccines, cholera vaccine, and influenza killed vaccine. The cold chain, you know, maybe you have heard now about COVID, keeping COVID vaccine against COVID. The cold chain is a system of storage and transport of vaccines at low temperature from the manufacturer to the actual vaccination site. It is necessary because vaccine failure may occur due to failure to store and transport under strict temperature controls. Among the vaccines, you see here different devices, how rooms, refrigerators. Among the vaccine, polio was the most sensitive to heat, requiring storage at minus 20 degrees. Now you know about some the Pfizer vaccine and some other against COVID. They need minus 70 degrees. So such vaccines should be stored in freezer compartment, and vaccines who may be stored in the cold part but never allowed to freeze are the typhoid, diphtheria, pertussis, tetanus, tetanus toxoid, diphtheria, tetanus, BCG, and the diluent, some diluents of the vaccines. No immune response is entirely free from the risk of adverse reactions. So we group the adverse reactions as reactions inherent to inoculation due to faulty techniques, due to hypersensitivity, reactions with neurological involvement, and provocative reactions. Provocative. Some reactions inherent to inoculation, these may be local or general. Local reactions may be pain, swelling, redness, tenderness, and development of a small nodule or sterile abscess at the site of injection. Here you see this case in a small child. The general reactions may be fever, malaise, headache. Most acute bacterial vaccines cause some local and general reactions. Diphtheria and tetanus toxoids and leaf polio vaccine cause little reaction. We don't see, I have seen too many children, more than maybe already 1,000 vaccines. I have seen only once such serious a local reaction. It was the vaccination was done in the type of one. This was the fourth application of a combination of 5 vaccines, pentaxim, and it was done not in Sofia. It was done in another Bulgarian city. So we sent the producer, the manufacturer was Pasteur, the French product, and we sent there all the history of this reaction. Reactions due to faulty techniques. They may be related to faulty production of vaccine, first of all, inadequate inactivation of the microbe or inadequate detoxification, too much vaccine given in one dose, improper immunization site or route, vaccine reconstituted with incorrect diluents, wrong amount of diluent used, drug substituted for vaccine or diluent, vaccine prepared incorrectly for use, not shaken properly, for instance, before use, contamination of the vaccine or diluent, stored incorrectly vaccine, ignored contraindications, a child who experienced a severe reaction after a previous dose, uh, for instance, with diphtheria, pertussis, tetanus vaccine, is again immunized with the same vaccine. Reconstituted vaccine of one session of immunization used again at the subsequent session. This is very dangerous. Risk of improperly sterilized syringes and needles carry the hazard of hepatitis B virus and staphylococcus and streptococcal infection. The anaphylactic shock is very rare but dangerous complication of injection of antiserum. Usually we see this in antiserum. There is, the bronchospasm, dyspnea, hypotension, collapse. The symptoms may appear within few minutes of injection or may be delayed up to 2 hours. Some viral vaccines prepared from embryonated eggs, this is the case of influenza vaccine, may bring about generalized anaphylactic reactions in people who have allergies against eggs. Some precautions to be taken before administration of the antiserum or antitoxin. It is necessary to test for sensitivity reaction, and this can be done in two ways. First, to instill a drop of the preparation into the conjunctival sac, and the sensitized person will develop a pricking of the conjunctiva. The more reliable way of testing is by intradermal injection of 0.2 milliliters of antiserum diluted 1 to 10 with saline, and the sensitized patients will develop a wheal and flare within 10 minutes at the site of injection. Of course, we should have in mind that these tests are not infallible, so we should be very careful with the history of the patient, the previous history of immunizations. Neurological manifestation may be seen after the administration of serum or vaccine, and the most well-known examples are the post-vaccinal encephalitis and encephalopathy following administration of anti-rabies and smallpox vaccine. Fortunately, they are used to smallpox no more, anti-rabies in special cases. The Guillain-Barré syndrome, which is a rare neurological disorder in which the body's immune system mistakenly attacks parts of its peripheral nervous system, is another example in association with the swine influenza vaccine. Here you have some details about Guillain-Barré syndrome, which is an acute inflammatory demyelinating polyneuropathy. It starts with symmetrical muscle weakness, usually begins in the legs and ascends, paresthesia in the hands and feet, and most cases are preceded by an infection such as Campylobacter enteritis. Later, you see the deep tendon reflexes are absent or depressed, and there is a severe respiratory muscle weakness necessitating ventilatory support, and the treatment is should be done in specialized centers. Neurological, the most beneficial is the immune globulin done intravena. A serious consequence of the vaccine. The provocative reactions occasionally following immunization, there may occur a disease totally unconnected with the immunizing agent. For instance, a provocative polio after diphtheria, polio, pertussis, tetanus, or DT administration against diphtheria. The mechanism seems to be that the individual is harboring the infectious agent, and the administration of the vaccine shortens the incubation period and produces the disease, or what may have been otherwise only a latent infection is converted into a clinical attack. Mild acute illness with or without fever, convalescent phase of illness, recent exposure to infectious diseases, current antimicrobial therapy, mild to moderate local reactions in previous cases, low grade to moderate fever after previous vaccination, history of penicillin or other non-vaccine allergy are not contraindications to immunization. Of course, I can't imagine that a doctor will do vaccination of a child with acute illness mild. How to decide that it is mild with fever, especially. So we are very careful, and we prefer to immunize absolutely healthy children. But there are some cases, urgent cases, that need vaccination, and really some mild disease are not a contraindication. Varicella vaccine is contraindicated for persons with cellular immunodeficiency, but it is recommended for persons with impaired humoral immunity, like hypogammaglobulinemia or dysgammaglobulinemia, where these lectures for immunity immunodeficient states follow next time. Serious contraindications are severe immunosuppression resulting from congenital immunodeficiency, presence of human immunodeficiency virus, serious infection, leukemia, lymphoma, cancer, therapy for cancer, and some cases of prolonged courses of high-dose corticosteroid, that means more than 2 milligrams per kilogram daily and lasting for more than 2 weeks. All this predisposes to complication and is contraindication for live virus vaccines. The risk of adverse reactions can be reduced by proper sterilization, proper selection of subjects and products. The vaccine should be reconstituted only with the diluent supplied by the manufacturer. and reconstituted vaccine should be discarded at the end of each immunization session and never retained for use in subsequent session. The refrigerator of the immunization center should be free of other drugs and substances. They should be stored somewhere else. There are the applications for active immunizations. Especially for infants and children, exists the so-called expanded immunization program or schedule. But there are some plans, schedules for active immunizations of adult females, vaccinations for special occupations, for special lifestyles, special environmental situation, health status persons, vaccinations in travel, and recently started vaccine against bioterrorism. The compulsory or obligatory vaccination for infants and booster vaccinations for children are the expanded immunization programs, and each country has its local schedules of vaccination. They do not differ very much in Europe. I have shown here a childhood program. Uh, as far as I remember, this is, for instance, for Canada. You see, then they do not differ very much. They start in the beginning immediately after birth with BCG vaccines and hepatitis B, and then on months second, 4, 6, and so on and so on. It is important to have the program of each country where you will reside or work. The capital letters in the name of the vaccine denote full dose vaccine, and the small letter A is for ACE, means acellular. And if you compare to TD or TDAP, this small letter denotes the half dose vaccine for booster effect. Diphtheria and pertussis vaccines are only given as combination with tetanus vaccine. So we have the diphtheria, tetanus, and acellular pertussis. The primary series are at the second, fourth, and sixth month. Then 12 or up to 18 months, at least 6 months after the third dose, we have another at 4 years. In Bulgaria, it is at 6 years. And then between the 12th and 4th year, we do tetanus, diphtheria, and acellular pertussis. You see small doses. And then we continue with tetanus in diphtheria boosters, full dose of tetanus, but half dose of diphtheria every 10 years, and this is till the end of our life. It is in all over the world, it is like this, the scheme for diphtheria, tetanus, and pertussis. Contraindications, once again, severe allergic reactions after previous vaccine dose, or if we know absolutely sure that there is allergy to a vaccine component. Encephalopathy in the patient, it's to say coma or decreased level of consciousness, or you have history of prolonged seizures, which are not attributable to another identifiable cause. Some of them if these events have been seen within 7 days of administration of previous dose. Some progressive neurological disorder, including infantile spasms, uncontrolled epilepsy, progressive encephalopathy. So these are serious contraindications, and they are for almost all of the vaccines. We need some precautions. The temperature, if there is temperature more than up to 40 degrees for 48 hours after previous dose of the vaccine, if we have seen collapse or shock-like state in this period after previous dose, seizures, persistent unconsolable crying. Sometimes this is you may see such reaction lasting more than 3 hours within 48 hours of a dose of the vaccine. If Guillain-Barré syndrome have been developed, and some moderate or severe acute illnesses with or without fear. Once again, details about precautions in all of the vaccine. I will not repeat them. The polio, is a very infectious virus, and but up to 95% of people infected with polio have no symptoms, and the small percentage, 4-8, have minor symptoms: fatigue, myalgia, stiffness, and less than 1% develop the paralysis from virus attacking the motor neurons. So it is a serious disease, and inactivated polio vaccine is done during the infant period. At the same time with diphtheria, tetanus, pertussis. In fact, they are now in a combined vaccine called pentaxim or hexaxima. So they receive 4 doses and boosters uh, as early as 4 years, but in Bulgaria it is at 6 years before starting the school. Hepatitis B. You know that viral infection can be transmitted perinatally from hepatitis B infected mothers. Symptoms range from none to severe hepatitis and liver failure. Up to 19% of infected neonates become chronic carriers. So, the vaccine against hepatitis B, we use Engerix B vaccine, a recombinant hepatitis B. The dose should be given shortly after birth. In fact, this is the first vaccine they receive after birth. If not given to the baby, we should have documents to order the hold of the vaccine, and we should have copy of negative maternal hepatitis B surface antigen in chart and documented by physician. If the mother is hepatitis B S surface antigen positive, we give hepatitis B and hepatitis immunoglobulin, and then we test for the surface antigen 1-2 months after completed vaccine series, and again at the age of 9 or 18 months. You will repeat this when you study the hepatitis. Just remember that an anti-hepatite vaccine is the first vaccine babies receive in the neonate ward. Haemophilus influenza, the next one, which is combined with the vaccines we talked about. Haemophilus influenza B, the so-called Hib vaccine. Prior to this vaccine, the Haemophilus was leading cause of childhood bacterial meningitis, epiglottitis, pneumonia, with complications like empyema, pericarditis, bacteremia, and septic arthritis. All of these diseases, although difficult with difficulty, but they can be treated. Bacterial meningitis caused by influenza is uncurable. So this vaccine was introduced, and now we don't have cases of bacterial meningitis due to Haemophilus influenza B that we saw earlier in children 4, 5 years of age. It was very dramatically. There are two vaccines for Haemophilus influenza in combination, different names, different producers, and different names. You will see in Bulgaria, you will see the Pentaxim, and now is the Hexasima or Infanrix Hexa, and the single vaccine Act Hip. They are interchangeable, and they are done at the same time with DTP, and polio, and hepatitis. This is the single vaccine. You should not remember because it is not used no more. It is conjugated to tetanus toxoid, but nevertheless, it is no more used. Here you have the combination of vaccines. Many of them come in combination. Different manufacturers make different components, multiple different combinations, and the vaccination schedule may vary based on which vaccines are given or available. I have chosen some examples of combination vaccine. For instance, Convax. It is a combination of Hib and hepatitis B. Then you have PEDIATRICS, tetanus, diphtheria, pertussis, polio, hepatitis B. Some other like trihibrid C, diphtheria, tetanus, pertussis, Hib, and many different painted cells. Just to have in mind, the pneumococcal disease is due to Streptococcus pneumonia and is common cause of community-acquired pneumonia and otitis media. It can cause invasive disease like bacteremia, meningitis, and sepsis, and the invasive risk is related to serotype which is present, serotype of pneumococci. The basic antigens are polysaccharides in the capsule of the microorganism, and according to them, pneumococcus have 84 serotypes. The most common in children are these serotypes 6, 14, 19, 23. So, several pneumococcal vaccines were invented, were produced. Prevnar 7, it conjugates 7 7 stamps of the serotypes of the pneumococ, and is recommended for all children up to second year of age. Now it is not combined with other vaccines, so we do usually we start with the combination of 6 vaccines at the one type, one leg, and we do the pneumococcal vaccine on the other leg. Here is another Prevnar with 13 serotypes, strains instead of 7. It is expanded vaccination for high risk groups, and it can be done up to 72 months at the same dose interval. High risk and contraindication, the same disease as in other cases. And some news for this vaccine is that a single dose may be done for children 6 to 18 years old who have risk for invasive pneumococcal disease. And it may be done regardless of previous vaccines with 7 strains or the pneumococcal vaccine with 23 strains. It is kept for older people. The risks for such children are the presence of sickle cell disease, HIV or some other immunocompromised state, cochlear implants, and cerebrospinal fluid, leak of cerebrospinal fluid. These are children, big age, who could be immunized with pneumococcal vaccine. In Bulgaria, we use Synflorix. It is a vaccine with 10 serotypes. Here, they are listed here, you see. It is conjugated with protein carriers, protein D, and tetanic and diphtheria toxoid. So, we usually do, just see this Pneumo 23, which is for older people with 23 strains for older people who have the risk of pneumonia. And see, we use here is the how it looks, the vaccine Synflorix. So we do 6 vaccines in one leg and Synflorix in the other one. The 6 ones are diphtheria, tetanus, pertussis, polio, hepatitis, and Haemophilus influenzae type B. Oral vaccines, the only oral vaccines who are not included in the obligatory schedule but are recommended are the vaccines against rotaviruses. Oral polio is no longer available, so only the rotavirus vaccine is given orally. It is available as a Rotatec or rotavirus. But important details are that they have narrow administration window. The first dose must be before 15 weeks, and the last dose must be before the 8 months of age. So we usually started at 3 months of age. At the second month, 4 month, and 6 month, they receive the 7 vaccines, combination of six plus antipneumococcal vaccine. And at month 3, 4, and 5, they receive the oral rotavirus. We have a special program now that allows us to give rotavirus vaccines. It is not obligatory, but all parents are ready to receive this vaccine. The BCG vaccine, it is called after Bacillus of Calmette and Guerin. The name came in 1906 by this French. They are not doctors. In fact, one is microbiology, the other is maybe veterinary medicine, I believe. This is it consists of attenuated strain of Mycobacterium bovis and is given 48 hours after birth. Then we continue at 7 years, 11 years, and it is the only vaccine that is done intradermal, always on the left shoulder, and we wait for reaction after the first, during the second month, a reaction which will leave a scar at the end. They will have a scar at the left shoulder. If there is, if the child comes regularly to consultation center, we follow during the month what is the situation on the left shoulder. Of course, if there is a normal reaction, the parents call us. Usually they say, oh, we have some change on the left shoulder, it is red, and there is papule or vesicule, and so on. But if there is no reactions, we follow each month when they come to the consultation center. But if at 7 months strictly there is no scar, we need to see if there is not need of a revaccination. But we cannot do this without a Mantoux test. We never revaccinate for against tuberculosis without Mantoux test. First, we should see if there is maybe there is still immunogenicity. So we do the so-called Mantoux test. It was once again, a French doctor who invented this test. It is a tuberculin skin test, tuberculin PPD. PPD comes from purified protein derivative, and it is strictly five international units, and it is reported after 72 hours, the result. So here you have, it is important because this is something very different from all the other vaccination, and here you have the test. The test is done with a special syringe because we should introduce 0.1 milliliter of PPD protein. The PPD here is in Bulgarian, of course, but you know Bulgarian a little bit. So it is intradermally. You see only the end of this special needle is introduced, and we must do this papule here. This is the Mantoux test. In the same way is done the BCG vaccination. It is intradermal. The tested is intradermal and the vaccination is intradermal, always at the left shoulder. Then we report after 72 hours and we measure. This is the correct report. We measure this infiltrate or papule and only. We don't measure the erythema, which may surround the infiltrate. So this is the incorrect report you see here, and you should do the correct report. If there is a normal reaction, we do not do revaccination. We wait for the next session. For instance, uh, this child who has not a scar at 7 months of age, it should be revaccinated at 7 years of age. So we wait until 7 years of age after the Mantoux test. And all this is written down in his document. No scar, but it is tested with Mantoux test. I don't know, but maybe you have seen such documents going to be students in Bulgaria, for instance. I know for we give many documents for students in USA, so they usually want the date. We should write the date of the tuberculin vaccination, BCG, or the last Mantoux test that is done of this person. The measuring of the Mantoux test, once again, we talk about negative reaction. If there is no induration, the zone of redness is less than 5 millimeters, and we have positive reaction when it is more than 10 milliliter. So in cases of negative reaction, we do a revaccination at 7 months of age, the first Mantoux test. That means that no immunogenicity was achieved with this first immunization in the neonatal ward. If we have the positive reaction more than 10 millimeters, we wait, of course, more than 10 millimeter, but no more than 15, because 15 millimeter, that means already infection with this bacil of Calmette-Guerin. So, some other important details about BCG vaccine are that it is the only vaccine with such a long interval from other vaccines. 1 month is necessary after BCG vaccine to continue with other vaccines. So when the baby is born and is vaccinated immediately after birth, we cannot start the other vaccines in the next month. We should wait. And so we started 2 months of age. After the Mantoux test, we wait for 15 days, only 15 days. But if revaccination is needed, Mantoux test is negative and we must do the revaccination, it should be done within 15 days after the test, because theoretically it may be infected if too many days pass. After the 15th day, it may be infected. So we should hurry when the Mantoux test is negative. We should hurry to do the revaccination in the next 2 weeks. The The next vaccination is the MMR vaccine against measles, mumps, and rubella. They are alive, attenuated viruses, and usually it is done at 13 months of age. After the ninth month, we can do it. And in Bulgaria, we do revaccination at 12 years of age. I have seen many different schedules in Czechia and Slovakia, they do it at 4 years of age, the revaccination. Some other countries, West Europe, they do it at 6 years of age. So it depends on the schedule of the country. We have two kinds of vaccines, Priorix and Trimovax. It's a French one. Priorix, I believe, is a Netherlands or Belgium. The Rotatec, the parallel. Uh, I'm sorry, this slide is in Bulgarian, but uh, I explained you all about Rotatec, Rotatec and Rotarix, the parallel vaccine that is done usually on the third, on the fourth, and it contains the rotavirus type G1, G2, G3, G4, and another one which, and they need 3 doses in between 6 and 32nd week. There should be a 4 weeks interval between the doses. Another recommended vaccine is the human papillomavirus vaccine. For girls, maybe you have heard that in England they have country has started to do it on boys and as well. You know that nowadays there are very the homosexual the homosexual style of life is quite expanding. So papillomavirus can do many harmful um, disease. You know, it is the main cause of neoplasma of genitals in women, but in boys, in men as well. The Cervarix, one of there are two kinds of vaccine, Cervarix and Silgard. The Cervarix has only two types. These are really the dangerous types, but only two. It is a recombinant, adjuvanted, absorbed vaccine, and then after between the 9 and the 4 years, you maybe you know that these vaccines should be done before the beginning of sexual life, before the first sexual intercourse, because the papilloma virus in men gives no symptoms and they don't know that they have it. So we prefer to vaccinate girls, young girls who have not started yet sexual intercourse. But my opinion is that this age is too early because the manufacturers uh, say that the good effect of the vaccine and is lasting absolutely for 9 years. 9 years, they assure 90% of immunogenicity. So maybe we should recommend to our girls to start. It's better, of course, to start sexual life after 15, even 16 years of age when they are quite physically developed and understand uh, psychologically understand not not only the need of sexual intercourse, but they understand the seriousness of these acts. So it's better to start the vaccination at 15 or 16 years when young people are more have much more connections and sexual as well. So they will have 9 years of perfect assurance with this vaccine. The Cervarix is done in 2 doses and on first month and then 5 up to 13, but usually we try to do it at the 6 month, no later. But if the child is more than 15 years, we give 3 doses. At the beginning, at the end of the first month, and at the 6 month. The other one is Silgard, which is better in my opinion because they have more more serotypes, the most dangerous serotypes. So, in summary, mm, about especially about the hepatitis B vaccine, which is very important in the beginning of life because it is easily spread. The virus, B virus, is easily spread through through blood. So if we we should absolutely do the birth dose. If not given, the reason for this should be must be well documented, and we should not give Haemophilus influenzae B vaccine to infants that are less than 6 weeks old because their immature immune system and they are not able to produce an appropriate immune response. These are important things for hepatitis B and hepatitis B vaccine. So that's all about vaccines, and we should do them absolutely according to the schedule of each country. You will travel, maybe you will work in your countries or some other world, so you will have, if you work pediatrics, you should know the exact schedules of the countries so that you will assure the proper vaccine. So that's all for today. What shall we decide for next week? Do you prefer to continue like this? Is it?
Uh, I think, Professor, it's better to be online. Like we have more people, it's more safe. And
Okay, okay. So, shall I wait for next Tuesday
yes,
five
I'll
to
send again the
receive?
same notification on the email, and I will send the link to the guys as well to join.
You need again my email.
No, 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 no. I will send you. I will send. I
You
will.
will send it. You will send it. Okay,
Also, I
okay.
have a question, Professor. You mentioned before that maybe there is anaphylaxis in some vaccines. What is happening with these children that they have this allergic reaction to the vaccine?
No, I have not seen. I have seen only one local reaction. I
Mm.
told you the lack of a child. We have never seen at our center an anaphylactic reaction. They are usually connected with. Uh, I think these are old histories of not very well purified antisera when earlier, before 20, 30 years, when diphtheria and tetanus, they are the toxoids who are produced by horses, and they give anaphylactic reactions, but they were not purified. Nowadays we don't have any allergic reactions with vaccines. They are very well produced.
Mm-hmm.
Mm.
Okay.
And except the now we do each year we do the influenza vaccine, anti-influenza, but it is a vaccine cultivated on embryons of eggs. So people who have allergies to egg, they may develop anaphylactic shock.
Mm-hmm. Mm-hmm.
This is the only danger.
Mm-hmm. Okay. Thank you. Also, could you please send us the syllabus of the final exam just to have it, just to prepare it, you know?
Okay, I will
Send
send
it
it.
to me and I will share with my colleagues as well.
I have your email.
Perfect. Yeah, yeah.
I have your email. I will send you this. I will send you this lecture, and I will send you the syllabus.
Yeah, perfect. Thank you very
Okay.
much. Thank you
Have
very
a nice evening. Bye bye.
much too,
Up
Professor.
to
Next time.
next Tuesday. Next Tuesday. Bye bye.
Bye bye.